Have you ever wondered why erectile dysfunction can sometimes appear years before a heart attack, or even before someone is diagnosed with serious cardiovascular disease? Most men think erectile dysfunction is simply a part of getting older. Others assume it's caused only by low testosterone or stress. But what if your body is trying to send you an early warning sign? What if changes in your erections are actually telling you something about your blood vessels? Today, we're exploring one of the most overlooked complications of diabetes and high blood sugar. It's a topic that many men are uncomfortable discussing, yet millions are affected by it. The good news is that understanding the connection is the first step toward protecting your long-term health. By the end of this video, you'll understand how diabetes can affect erections, why it happens, what factors increase the risk, and the practical evidence-based habits that may help support better vascular and metabolic health. Let's begin with something that surprises many people. An erection isn't just about sexual health. It's actually a complex process involving your brain, nerves, hormones, blood vessels, and muscles, all working together in perfect coordination. If even one part of that system isn't functioning well, it can become more difficult to achieve or maintain an erection. Think of it like turning on a garden hose. For water to flow properly, the faucet has to open, the hose must be clear, and the pressure has to be strong. If the hose is kinked or partially blocked, the flow becomes weaker. Something similar can happen inside the body. Healthy erections depend largely on healthy blood flow. That simple fact helps explain why erectile dysfunction is often linked to conditions that affect the cardiovascular system. Now let's talk about diabetes. When blood sugar remains elevated over long periods, it can place extra stress on blood vessels and nerves throughout the body. This doesn't happen overnight. It's usually the result of years of metabolic changes. Over time, chronically high blood sugar may contribute to inflammation and changes in the lining of blood vessels. Healthcare professionals call this lining the endothelium. The endothelium plays an important role in helping blood vessels relax and widen when needed. When it isn't functioning normally, blood flow may become less efficient. Since erections rely on healthy blood flow, it's easy to see why vascular health matters so much. But blood vessels are only part of the story. Your nervous system is equally important. The brain sends signals through nerves that help trigger the physical changes required for an erection. Long-term diabetes may affect nerve function in some individuals. If those signals become weaker or slower, communication between the brain and the body may not work as effectively. Again, this doesn't happen to everyone with diabetes. Risk varies from person to person. It depends on many factors, including blood sugar management, overall cardiovascular health, age, lifestyle habits, and genetics. Here's something many people don't realize. The arteries that supply the penis are much smaller than the arteries supplying the heart. Because they're smaller, they may show signs of reduced blood flow earlier. That's one reason researchers believe erectile dysfunction can sometimes appear before symptoms of heart disease. It's not necessarily causing heart disease. Instead, both conditions may reflect changes occurring in the blood vessels. That's why many healthcare professionals encourage men not to ignore persistent erectile problems, especially if they also have diabetes, high blood pressure, high cholesterol, or a history of smoking. Your body often gives subtle clues before larger problems develop. Learning to recognize those clues can be incredibly valuable. Now, here's another question. Does having diabetes mean you'll definitely develop erectile dysfunction? No, absolutely not. Many men with diabetes never experience significant erectile problems. Others notice only mild changes. The goal isn't to create fear, it's to understand risk. Because once you understand the factors involved, you can begin focusing on the things you can influence. Let's look at one of those factors, nitric oxide, You may have heard this term before. Nitric oxide is a naturally occurring molecule that helps blood vessels relax. When blood vessels relax, they can widen. That allows more blood to flow where it's needed. Healthy nitric oxide production is one reason regular exercise is so beneficial for cardiovascular health. Researchers continue studying how conditions like diabetes, smoking, physical inactivity, and high blood pressure may influence nitric oxide availability. The important takeaway is simple. Healthy blood vessels are better able to do their job, and healthy blood vessels support many aspects of health, not just erections. Now let's shift our attention to another important piece of the puzzle: insulin resistance. Long before someone develops type 2 diabetes, many people experience insulin resistance. In simple terms, the body's cells become less responsive to insulin. To compensate, the pancreas produces more insulin. This process can continue for years before blood sugar rises enough to meet the criteria for diabetes. During this time, other metabolic changes are often occurring as well. Higher levels of inflammation, changes in cholesterol, increased abdominal fat, elevated blood pressure, reduced physical fitness. These factors don't exist in isolation. They often occur together as part of overall metabolic health. That's why improving metabolic health isn't about solving one problem. It's about improving the entire system. And that's encouraging, because many of the same habits that support heart health also support healthy circulation throughout the body. We'll talk about those habits in just a moment. But first, there's another misconception we need to address. Many people believe erectile dysfunction is purely psychological. Stress can certainly play a role. So can anxiety, depression, relationship difficulties, poor sleep, and emotional well-being. The brain is an essential part of sexual function. However, physical and psychological factors often overlap. Sometimes it's primarily emotional. Sometimes it's primarily physical. And often, it's a combination of both. That's why it's important not to jump to conclusions or self-diagnose. Persistent changes deserve a conversation with a qualified healthcare professional who can evaluate the full picture. Here's something else worth remembering. Lifestyle factors matter. Smoking can damage blood vessels. Excessive alcohol use may interfere with nerve function and hormone balance. Poor sleep has been associated with changes in hormones, appetite regulation, and metabolic health. Physical inactivity can reduce cardiovascular fitness over time. Each of these factors may contribute to overall vascular health. The encouraging news is that many of them are modifiable. Small improvements made consistently over months and years can have meaningful benefits for overall health. Before we continue, I want you to think about one question. If erectile dysfunction can sometimes reflect what's happening inside your blood vessels, what other warning signs might your body be giving you before serious disease develops? The answer may surprise you, because in the next section, we'll explore the everyday habits that silently increase risk, the myths that prevent many men from seeking help, and the evidence-based strategies that support both metabolic health and healthy circulation. Now that we understand why healthy blood vessels and nerves are so important, let's talk about something even more practical. Why do some men with diabetes experience erectile dysfunction while others do not? The answer isn't one single factor. It's the combination of many influences over time. Think of your health like a savings account. Every healthy habit is a deposit. Every unhealthy habit is a withdrawal. One withdrawal won't empty the account. But years of withdrawals without enough deposits can eventually create problems. Your blood vessels work much the same way. One high sugar meal doesn't cause erectile dysfunction. One missed workout doesn't either. What matters is the overall pattern. Let's look at some of the biggest lifestyle factors researchers associate with both metabolic health and erectile function. The first is smoking. Smoking exposes blood vessels to harmful chemicals that can reduce their ability to expand properly. Over time, this may affect circulation throughout the body. The second is physical inactivity. Your cardiovascular system responds to movement. When you walk, cycle, swim, or perform resistance training, your heart pumps more efficiently and your blood vessels become more responsive. Regular movement also supports healthy blood sugar management, body weight, and overall energy levels. The third factor is excess body fat, especially around the waist. Carrying excess abdominal fat is often associated with insulin resistance, inflammation, and other metabolic changes. Again, this doesn't mean everyone with abdominal fat will develop erectile dysfunction. It simply means the risk may increase when several factors occur together. Sleep is another piece of the puzzle that many people underestimate. Poor sleep doesn't just leave you feeling tired. It affects hormones that regulate appetite, stress, recovery, and metabolism. Consistently poor sleep has also been associated with reduced testosterone levels in some men. Testosterone isn't the only factor involved in erections, but it does contribute to sexual health, muscle maintenance, bone health, and overall well-being. This brings us to another common myth. Many advertisements claim that erectile dysfunction automatically means low testosterone. That's simply not true. Some men with low testosterone experience erectile problems. Many do not. Likewise, many men with normal testosterone levels still develop erectile dysfunction because the underlying issue involves blood vessels, nerves, medications, or other health conditions. This is exactly why proper evaluation matters. Treating the wrong problem rarely produces the right result. Now let's discuss stress. Stress is a normal part of life. Your body is designed to handle short periods of stress. The challenge comes when stress becomes constant. Long-term stress may influence sleep quality, eating habits, physical activity, and overall health. It can also increase anxiety around sexual performance. For some men, one disappointing experience leads to worry. That worry creates even more difficulty the next time. A cycle begins. Breaking that cycle often requires addressing both physical and emotional health. Another important topic is medications. Some prescription medications used for conditions such as high blood pressure, depression, or other medical issues may contribute to erectile problems in certain individuals. This doesn't mean anyone should stop taking prescribed medication. Far from it. If you have concerns, discuss them with your healthcare provider. There may be alternative options or adjustments that better fit your individual situation. Never stop medication without professional guidance. Now here's a question that's becoming increasingly common. Can prediabetes affect erections? Research suggests that insulin resistance and other metabolic changes can begin long before someone receives a diagnosis of type 2 diabetes. This is one reason why maintaining a healthy lifestyle is valuable even before blood sugar reaches diabetic levels. Protecting metabolic health isn't just about preventing one disease. It's about supporting the health of your entire body. Let's talk about food, not miracle foods, not superfoods, just consistent, balanced nutrition. Many nutrition experts encourage dietary patterns centered around vegetables, fruits, legumes, whole grains, nuts, seeds, lean proteins, and healthy fats. These foods naturally provide fiber, vitamins, minerals, and antioxidants that support cardiovascular and metabolic health. At the same time, reducing excessive intake of highly processed foods and sugar-sweetened beverages may help support healthy blood sugar management. Notice what we're not saying. We're not saying one food cures erectile dysfunction, because no single food does. Health is built through patterns, not isolated choices. Exercise deserves another mention because its benefits extend far beyond burning calories. Regular physical activity supports blood circulation. It helps improve insulin sensitivity. It strengthens the heart. It contributes to weight management. It supports mood. And it may improve confidence and quality of life. These are powerful reasons to stay active regardless of age. Now let's address one of the biggest myths on the internet. You may have seen videos claiming that one herb, one vitamin, or one drink can permanently cure erectile dysfunction. Be skeptical. Human biology is far more complex. If a claim sounds too good to be true, it usually deserves closer examination. Evidence-based healthcare rarely offers instant solutions. Instead, it focuses on identifying underlying causes and addressing them appropriately. That's not as flashy, but it's much more reliable. Here's another fact that surprises many people. Erectile dysfunction can sometimes motivate men to improve their overall health. In many cases, it becomes the reason someone finally begins exercising, quits smoking, improves nutrition, loses excess weight, gets blood pressure under control, or schedules a long overdue medical checkup. In that sense, paying attention to the body's signals can lead to positive changes that extend far beyond sexual health. Remember, erections are influenced by the health of your blood vessels, and those same blood vessels are supplying your heart, your brain, your kidneys, and every other organ. Supporting vascular health benefits your entire body. So what should you actually do if you've noticed persistent changes? When should you seek medical advice? And what questions should you ask your healthcare provider? Those answers are incredibly important because the final part of this video brings everything together into a practical action plan that focuses on long-term health, not quick fixes, and explains why addressing erectile dysfunction may be one of the most important conversations a man can have about his overall well-being. So, what should you do if you've been experiencing persistent erectile dysfunction? The first step isn't panic, and it isn't ordering the first supplement you see online. It's understanding that your body may be asking for attention. Erectile dysfunction is common. In fact, millions of men experience it at some point in their lives. For some, it's occasional. For others, it becomes more frequent. An occasional problem after a stressful day, poor night's sleep, or heavy meal is not unusual. But if the problem continues for several weeks or months, it's worth having an open conversation with a qualified healthcare professional. Many men avoid that conversation, not because they don't care, but because they're embarrassed. They worry they'll be judged, or they'll simply be told, it's just part of getting older. The truth is that erectile dysfunction isn't something you should feel ashamed of. It's a medical issue, just like high blood pressure, high cholesterol, or diabetes. Healthcare professionals discuss these concerns every day, and in many cases, erectile dysfunction can be an opportunity to uncover other health conditions that might otherwise go unnoticed. That's why many experts describe it as a potential early warning sign rather than simply a quality of life issue. Now let's talk about what your healthcare provider may evaluate. Depending on your individual situation, they may ask about your medical history, your medications, your sleep, your stress levels, your physical activity, your diet, smoking, alcohol use, and other lifestyle factors. They may also recommend checking blood pressure, cholesterol, blood sugar, or other laboratory tests if appropriate. The goal isn't just to treat a symptom, it's to understand why it's happening. Because effective care begins with understanding the cause. Now let's return to diabetes. If you already have diabetes, one of the most important long-term goals is working with your healthcare team to keep your condition well managed. Healthy blood sugar management isn't only about protecting your eyes or kidneys, it's also about supporting your blood vessels, nerves, heart, and overall quality of life. Every healthy choice contributes to that goal. Let's review some habits that consistently appear in scientific research on metabolic and cardiovascular health. Move your body regularly. You don't need to train like an athlete. A brisk walk, cycling, swimming, strength training, or any activity you enjoy can become part of a healthier routine. Consistency matters far more than perfection. Eat a balanced diet built around minimally processed foods. Fill your plate with colorful vegetables. Include fruits in appropriate portions. Choose lean proteins. Enjoy healthy fats from foods like nuts, seeds, olive oil, and fish. Increase fiber whenever possible. Small improvements repeated every day often produce meaningful results over time. Protect your sleep. Aim for a regular sleep schedule. Create a relaxing bedtime routine. Limit excessive caffeine late in the day if it affects your sleep. Keep your bedroom cool, quiet, and dark whenever possible. Your body performs much of its repair work while you sleep. Manage stress in healthy ways. No one can eliminate stress completely, but regular physical activity, mindfulness, hobbies, meaningful relationships, and time outdoors may all support emotional well-being. Don't smoke. If you do smoke, consider talking with your healthcare provider about strategies to help you quit. Stopping smoking benefits nearly every organ in the body, including your blood vessels. Limit excessive alcohol. Moderation is important. Heavy alcohol use may contribute to several health concerns, including those affecting sexual function. Keep regular medical appointments. Many conditions, including high blood pressure, high cholesterol, and diabetes, can progress quietly. Routine checkups help identify changes early when there may be more opportunities to manage them effectively. Now, let's address one final myth. Many people search online for a single miracle cure. One vitamin, one herb, one secret drink, one exercise, one overnight solution. But lasting health rarely works that way. The human body is remarkably complex. That's actually encouraging, because it means you don't have to rely on one perfect answer. Instead, you can improve many small areas of your health at the same time. Imagine improving your nutrition by just 10%, walking a little more each week, sleeping 30 minutes longer each night, reducing stress where possible, keeping your blood sugar within the goals recommended by your healthcare team. None of those changes is dramatic by itself, but together they create momentum, and momentum leads to progress. Before we finish, I want to leave you with one important thought. Erectile dysfunction isn't simply about intimacy. For some men, it may be one of the earliest visible signs that their blood vessels need attention. Listening to that signal could encourage healthier habits that benefit your heart, brain, kidneys, and overall well-being for years to come. So don't ignore the conversation. Don't let embarrassment prevent you from seeking answers. And don't fall for quick fixes that promise more than science can support. Instead, focus on what we know works: healthy eating, regular movement, quality sleep, stress management, avoiding tobacco, working closely with your healthcare provider, and taking small, consistent steps toward better metabolic health. Those habits won't just support sexual health, they support a healthier life. If you found today's video helpful, I'd love to hear from you. Have you ever been surprised to learn how closely blood sugar and blood vessel health are connected? Share your thoughts or questions in the comments below. Your experience could help someone else who may be silently struggling with the same concerns. And if you're new to HEH with Dr. Vivian Hart, welcome. Our mission is simple: to turn complex medical science into clear, practical information you can understand and use. Every week, we explore topics like diabetes, blood sugar, heart health, nutrition, sleep, fatty liver, brain health, and healthy aging, always with an evidence-based approach and without sensational claims. If that's the kind of content you value, be sure to subscribe and turn on notifications so you never miss a new video. And if you know someone living with diabetes or concerned about their metabolic health, consider sharing this video with them. It might encourage an important conversation they didn't realize they needed. Thank you so much for spending your time with me today. Take care of your health, take care of yourself, and I'll see you in the next video.